Okay, so 6B is Contract Blue Cross Blue Shield Medicare Advantage. John Anderson, Risk and Insurance Manager.
Hello. Yes, it's a beautiful fall day, isn't it? This first contract is our Medicare Advantage renewal. We received a favorable renewal on our Medicare Advantage, which covers all of our Medicare eligible retiree segment. It is $10 less per month per contract than it was in 2017, and they also offered to give us a $250,000 retention credit, which can be applied toward our fully insured rates. So our overall savings for 18 is expected to be $504,000 on the Medicare Advantage program.
Support by Sauger. Any questions?
Was he done with his presentation?
Oh, I'm sorry.
You done with that?
Well, I'll also say that they also extended for years 2019 and 2020 an option for us to renew with a maximum 5% increase only per year. So that's very good as well.
Okay, thank you. Commissioner Myjak?
Thank you. So this is for
I'm
Blue
sorry.
Cross Blue Shield, correct?
That is correct, the Medicare Advantage program.
Can you help me out here, please? I am sorry. What exactly is the Medicare Advantage in a sentence or two?
This is the coverage that we have in place for our retiree segment
Okay.
that is Medicare eligible.
Okay.
And they are put on this particular plan. It's a supplemental plan to Medicare.
Okay.
So it fills all the gaps for Medicare and gives them a very good supplement.
Very good. And the premiums, it says 2.2% decrease.
That is correct. It went from $449 to $439 per contract per month.
Okay, and may I ask a question? The last 5 or 10 years, what has been the trend on this type of program, this type of insurance?
Well,
rate increases.
for 2017, there was a 9.9% increase.
Okay.
And before that, I've tried to manage it in the single digits.
That you've tried to manage it
Yeah, it's
in
been
your
in this-
tenure here for the last 10 years, roughly?
Since 2011 or 2010, January 1st, we've had a Medicare Advantage type supplement.
I understand.
And then in 2013, I believe, is when Blue Cross took over
Okay.
for their MA product.
And once again, maybe you might have said it, but I didn't understand it. So because it's gone down by 2.2%, why has that gone down?
Well,
Just a discount with
I would say just competition in the marketplace.
competition in the marketplace?
Yes.
In Southeast Michigan, the whole country?
It would be probably just in our Southeast Michigan area.
So do you think, is that a normal thing going around the whole country?
No, normally we've seen double-digit increases throughout healthcare throughout the United States for the retiree segment and for the actives.
But not for our employees here under this contract.
That is correct.
Thank you.
Thank you, Chair Smith.
Thank you. Rob pretty much asked my question. I didn't know if it had to do with our seniors, our retirees being a little healthier and using, less insurance, or if that has something to do with it, or is it strictly a competition thing that they want to stay in the market? I'm just wondering if we're doing something right.
I think we're doing
causes
something
this.
right because it is rated. It is rated. So they know, in other words, Blue Cross will look at the claims that came in for last year, and then they'll rate it based on the claims. So we must be doing something right.
Okay, thanks.
Thank you. I don't see anybody else on here. Please vote on your iPad. Item passes 12-0. Item B is contract Blue Cross Blue Shield PPO and BCN administrative and stop-loss fees. I'm going to seek the motion before you go ahead and give your presentation. Moved by Commissioner Brown, supported by Commissioner Duge. Go ahead.
Yes. Part of this is actually a new contract. And the new part of the contract is having to put administrative and stop-loss fees into the mix for our BCN HMO, which we've traditionally in the past have had fully insured. Now, after a review of the claims for the past year and more, we came to the conclusion that a group this size that we have in place is more efficient for us to follow a self-insured model. That means no longer would we be paying Blue Care Network on a monthly fully insured basis. We will be paying the claims as they come in, much like we do the claims as they come in for our PPO. Excuse me. Which means you have to have additional layer of a contract. They will administer the claims, and they will set forth a stop loss, which limits our liability per contract on the expenses that we would have to pay medically for a contract. And that is at $350,000. We are moving the stop loss to $350,000 for all of the self-insured products. So last year, or should I say this year, it's at $275,000. We reviewed the claims that came in and found there were no claims that hit the $275,000. So at this point, we are able to consider absorbing a higher loss threshold, which will reduce our rates as far as our stop loss goes. So we're able to absorb a higher amount based on the claims experience. Now, we can change this year to year if we decide that there's a negative trend going, or if all of a sudden we start getting a lot more claims that are hitting the $350,000. We can make adjustments a year from now or whenever we receive the data. Now, part of this, and it ties into the next contract, but I'll give you the overall view. The next contract shows that we will have HAP also become a self-insured entity. For our history, we've always had HAP on a fully insured basis where we pay a monthly premium for our employees. Now we are going to absorb the claims, pay the admin fee and the stop loss. And based on the claims data that Steve Schmiegel ran, the numbers, we expect to save $1.8 million overall in our healthcare spend by moving the two HMO products to a self-insured basis. We produced the claims, we added in the new fees, which is the stop loss and the admin fee, and we added a 10% trend. So all of that considered, after all that was added, we still saw a $1.8 million decrease in spend over our fully insured renewal that we received for 2018. So it looks very favorable that we moved to this self-insured product, and we had been contemplating it for a while, but the numbers have now proven it out that it makes sense to do. So that's why you'll see not only the BCN added with administrative and stop loss, but for the next contract, which is the HAP product, you'll see the administrative and stop loss added to that because they will no longer be fully insured. So that's it in a nutshell. It will also help us manage our health care more efficiently because we will be seeing the claims as they come in. We will be seeing areas of perhaps some health improvement we can emphasize to our employees. They can do their health assessments and things like this where we can motivate our employees better instead of being on a fully insured where neither the employee nor the county was aware exactly where the dollars were being spent on a monthly contract. This way we'll see, oh, we've had this many folks in that need high blood pressure care, or we have people that need asthma care, or what have you. And we will be able to better look and visualize the health services that are being performed for our employees and also offer some enhancements down the road when we figure out, how we want to drive our health care costs, which would be a healthier employee will mean less cost to the county.
Thank you. Commissioners, don't get too detailed in your questions. His voice isn't going to make it through this presentation.
Yeah, I apologize.
Chair Smith?
Thanks. As long as that's covered on our health insurance, right?
Yes, it
All
is.
right, good. So you said 1.8 and then 504,000 for the Medicare Advantage. So it looks like at this point we're at least anticipating $2.3 million in savings in healthcare next year over what we anticipated, which is obviously a good thing. Also, so two things. I want to know if this is new, so I'm guessing this wasn't part of the budget originally, right, Steve? That doesn't, the original budget shows the fully insured rates, I'm guessing. And last, while Steve's walking up here, it also incentivizes our employees and us as managers to encourage healthy lifestyles for our employees, so I like to hear that.
Yeah, you're correct that the budget included an assumption of fully insured rates, so this will
Okay,
have a positive budgetary impact.
great. All right, that was it. Thank you. Thanks, John.
Okay, Commissioner Carabelli?
Thank you, Madam Chair. Just so I can get a good understanding on it, we went through on the first part on the, that was already approved, the contract with Blue Cross Blue Shield, and I understand that there's actually, was it a reductions in savings? But it also had an increase of participants of 218 from what it was previously. So the number went down for individual of $238 per person, but we went up additional people going onto that program.
That's correct. There's more retirees.
Right. So with that said, going into this program, you're saying you get a 27% decrease. My question for you is that an actuarial report they gave you, or you guys came up with your own? Where did you base that off of years? Like, did you say, okay, here's a 3-year snapshot, or it was a 5-year, or how did you come up with your determination of saying, okay, it's a 27% decrease, but was that just from last year? Because remember,
Yeah, that's for the PPO and BCN stop loss and admin fee. The stop loss decreased 27% from 2017. It was 57.52 in 2017. This year, going forward, it will be 42.02 in 18, which represents a 27%
and I agree
decrease.
with your numbers. My question is that what will be the previous snapshot prior to that, and then before that to say, okay, here's my trend? You understand my question? I know it looks good for 1 year, but now we're talking about the self-insured, and we're actually going to be paying more in administrative fees for them to handle that, to administer it for us, right?
That's correct.
Both programs. So we're talking, $3+ million just in that, not to stop, but just in that portion of administrating. And I agree with what you're saying, but I guess I'm asking for a little longer picture rather than just from this year to last year. I'd like to see what it was for at least 2 years to say that trend is correct. Yep, this makes sense to be self-insured, not just because 1 year we had a good year and no one got sick or no catastrophic scenario. Because it makes me a little nervous.
Right.
I'll be honest.
Well, the actual success of this program probably won't be identified for 15 months, where we have a full 12-month claims come in, and then there's like a 3-month runoff. So in about 15 months from January 1st, we should have an excellent idea of whether our numbers came in on point. Because claims are going to be claims. We might, like you say, you could have a bad year with claims, and at the end of the day, you know, I don't know exactly what the claims are going to come in. It was based on at least a 1-year snapshot, maybe more, but I know for sure a 1-year snapshot was used to take a look back and see what the claims were coming in at, and then after we added in the extra fees, just to see if it even made any sense.
And it made sense, okay. All right, thank you, Madam Chair.
Thank you. Commissioner Romano?
Thank you, Madam Chair. I just want to make sure I get a grip of this. So are you saying when we put this stopgap at 350, that Blue Cross Blue Shield never reached that threshold, or have they surpassed that threshold? And are we saying 350 is what we feel we maximum should pay, keeping that figure in mind and the number of contracts? And I think you said 1943, 1,943. The question is, as these seniors get older, like myself, I'm sure that the claims are going to be greater and a lot more of them. So I don't understand this 350 stopgap. If in fact Blue Cross is willing to absorb that now, we're taking it on. Why would we want to do that? And as I said, we're getting an older retiree section, and we're getting more of them. Maybe I don't get it. Maybe.
Well, remember, this is, for the most part, our actives. The retirees are covered under our Medicare Advantage, which is Medicare eligible, 65 and over.
Right.
So for the most part, these are going to be our active employees and young retirees. And it's a question of this year, we took a chance on being at 275,000.
Right.
And after looking back and seeing how many claims came in at 275,000, there was 0. So we said, well, we have an opportunity to take a step forward and absorb a little bit more of a risk going forward because we didn't have anybody even hit the 275. Let's go with the 350, see how that works out. And then during the next 12 months, we'll be able to see how many hit the 350, how many hit whatever point of claims experience that they had, and then make another decision, because we can change this again going forward. So we're constantly looking at that as the template is to see how many claims are coming in at the stop loss max.
I wanted to see if we did have that option to change it in the future.
Yes. Yeah, we can change that next year.
Thank you very much. Thank you, Madam Chair.
Thank you. Commissioner Leonetti?
Thank you, Madam Chair. Just to continue on with that same question, and thank you for being here. I know it's not easy when your voice is hoarse.
That's okay.
I've had to try a case like that. It's horrible. In any event, the question of what can be changed, can we go back? Let's just say it gets really bad, and we decide, can we go back to a fixed administrative fee schedule? Or when you say change, are you talking about changing it from 350 back down to 275, or from 350 to up to 400?
Yes.
What can be changed? All of that, or?
Well, we would look back at the claims.
Right.
And see if we're hitting the points that we want to hit to see if it makes sense to move it up or down or keep it the same. If we move it up, it's going to cost less.
Correct.
Because we're absorbing more of a risk. If we move it down, it's going to cost more, but it might make sense to move it down if we're getting a lot of claims, let's say, in the $300,000 level.
Right.
So it's all about what claims come in the next 12 months.
And I understand. So we can always change on the stop loss, that number, that 350 number can always be changed every 12 months.
Yes.
The question is, can we go, let's say it gets catastrophic for whatever reason, can we ever go back to the administrative fee approach?
You mean a fully insured?
Yes.
Yeah, we can change it back to fully insured next year.
Okay. So
Yeah.
we can, okay.
We can move it. Like I say, we're going to have a better snapshot within 12 to 15 months that will either say, yes, you made the right move, or, whoa, that wasn't the way to go at this point.
Right. Okay. Well, no, thank you. Thank you for your analysis, for putting this together and looking for cost savings like this. I know with insurance companies it's tricky, and I'm looking forward to see what the data says in a year.
Okay.
Thanks.
Yeah, me
Yep.
too.
Okay.
Yep.
Commissioner Gillette?
Thank you, Madam Chair, and thank you for what appears to be a great work at getting us the savings as a county. Appreciate that, both you and the Finance Department and all the work you're doing here. Let me just ask, is there any change in coverages that the employees will see?
No, absolutely none. It'd be seamless.
Okay, so no change in what's covered. Okay, that's all I had. Thank you very much, Madam Chair.
Thank you. Commissioner Myjack?
Very good work, John. Thanks for all your great work on this, but I just have one question. If we were to renew at the full insured rate for 2018, what would be the inflation from one year to the next? Any idea?
They were looking at about a 5.5% increase overall for our fully insured rates on the HMO products.
Okay.
So that's what we would have been seeing versus we expect to have a decrease.
Okay, and another question, do you know 5% rate, is that standard in the industry, in this state, or the country? I've asked you this every year.
Yes.
So,
I would say it's on the lower end of our state to have a 5% increase offered to us on a fully insured basis.
okay, thank you.
Thank you. Commissioner Brown.
What's the family rate for family coverage rate and single coverage rate? What are the premiums? What are we paying per individual and for family coverage?
Well, it's going to be an illustration
Well,
because we have to just predict.
predict what? There we have family
it will
coverage, we have
be-
single coverage.
Well, just a moment. You have the exact rate, Steve.
If you don't have it, you just
I think
email it
Steve
to
might
us.
have the exact rates. But that's all part of that illustrative thing. When you switch to a self-insured product, you have to come up with a rate yourself. Okay.
Well, what do we budget?
Okay, so for let's look at HAP. If you had HAP, the single would be $558, the double $1167, the family $1521 per month.
Okay.
Now, if you had Blue Care Network, single $543, double $1134, family $1480.
Okay, thank you.
Mm-hmm.
Good number. Good job, by the way. Good whole team. Good job on getting this done. So, well done. It's not easy. It's complicated, but
HR also had a hand in this as well.
thank you. Team effort.
Yep.
Thanks.
Thank you. Commissioner Toko. Okay, seeing nobody else, where's Bob? Please vote on your iPad. Where's Bob? He wants to vote. Okay, motion passes 12-0. Oh, you counted Bob. Okay, motion passes 11-0. Okay, so item C, item D, contract HAP HMO administrative and stop-loss fees. Is there a motion? Moved by Carabelli, supported by Leonetti. And I think you already spoke to this, didn't you?
Yeah, I tied it into the last one. But it basically shows that we have now a new financing arrangement with HAP versus the fully insured. We're now self-insured. They're going to get their administrative and stop-loss fees, and we're going to get the claims directly from HAP and pay
Okay.
them.
So I don't have any speakers on here, so please vote on your iPad. Motion passes 11-0.